What actually causes an erection? And why can it suddenly disappear? Most people think it's just blood flow, but the real mechanism is far more precise. Today, we're breaking it down visually. No fluff. Just real anatomy. This is a cross-section of the penis. Inside, there are three key structures. Two corpora cavernosa on top, and one corpus spongiosum below. These are called erectile tissues. Why erectile? Because they can rapidly fill with blood. And that's what changes size and rigidity. Let's zoom into the corpus spongiosum. Right in the center is a channel. That's the urethra. It runs all the way through. Now look at the outer surface. Everything is wrapped in a tough layer called the tunica albuginea. This layer is extremely important. It's not just a covering. It controls expansion and pressure. Between the two corpora cavernosa, there's a septum dividing them. Now let's switch to a clearer model. Here, you can see layers from outside to inside. First comes the skin. Under that is the superficial fascia. Inside this layer are vessels and nerves. Arteries supply blood. Veins drain it. And nerves control sensation. Especially the dorsal nerve of the penis. Now back to the erectile tissues. Inside them are countless tiny spaces. We call them vascular sinusoids. Think of them like a sponge. Empty at rest. But expandable under pressure. Now raise the key question: how does an erection actually happen? Step 1: arterial inflow increases. Blood rushes in through the deep arteries. These arteries penetrate the erectile tissue. And fill the sinusoids. Step 2: expansion begins. The tissue swells as blood accumulates. Pressure starts to rise. Step 3: venous outflow is restricted. Veins get compressed against the tunica. This traps blood inside. Now more blood enters than leaves. That's how rigidity develops. Not just inflow but controlled outflow. This balance is everything. Now let's reverse the process. What causes detumescence? First, arterial inflow decreases. Less blood enters the tissue. Second, veins reopen. Blood starts draining out again. Pressure drops. The tissue softens. And size returns to baseline. Now raise something most people get wrong: the penis contains no bone. So what is a penile fracture? It's actually a rupture of the tunica albuginea. Usually due to sudden trauma or bending. When it tears, blood escapes into surrounding tissue. That creates swelling and deformity. Which feels like a fracture. But it's actually a vascular injury. Understanding this matters. Because misuse or excessive force can cause real damage. Now you understand the full mechanism: structure, blood flow, and control. If this made things clearer, you'll want to see what's next. We'll break down more medical topics that most people misunderstand. Drop your questions in the comments, and subscribe for the next deep dive.